My government's Vision 2030 aims to transform our country, Kenya, into a newly industrialized middle-income country, providing a high quality of life to all her citizens by 2030. We believe that improving the health and welfare of citizens in their lives guarantees our economic growth and competitiveness by ensuring healthy, productive populations. The attainment of universal health coverage by 2022 is one of 4 big agenda of my administration. Focus is on ensuring access to affordable, quality health services as a basic for ending extreme poverty, improving productivity, especially in low-income and middle-income areas. In December of 2018, I commissioned a pilot of the universal healthcare implementation, targeting a population of 3.2 million to inform its national scaling. In its 9th month now, the pilot focused on investment in strengthening primary healthcare, and it has been instructive in identifying best practices, lessons, and gaps in implementation. Let me share with you some of the key lessons and best practices in our journey towards UHC. First, political commitment is essential to the success of universal health coverage. This commitment must embody a shared vision of all political leaders in the country and actors, especially in counties with more than one level of government like Kenya. Furthermore, the commitment will only be impactful if translated from a shared vision to collaborative action. Second, the largest dividend that can be gained from political commitment is the mobilization of community and citizen ownership of universal health coverage. Indeed, the principle of leave no one behind needs to resonate with each and every citizen, thus reinforcing the much-needed social accountability for the success of service delivery in all interventions. Third, the harmonization and alignment of all action and interventions by health sector actors, where local, national, and international is absolutely necessary. Sustainable impact and efficiency gains can only be accrued from an alignment and synergy of action as articulated in the Global Aid and Development Effectiveness high-level fora in Paris, Accra, and Busan in the years 2005, 2008, 2011, respectfully. Fourth, we are cognizant of the indivisibility and interdependence of health system interventions. While a great impetus is placed on financing of healthcare systems, we have learned that progress towards universal health coverage will require an integrated whole-of-government approach and a health system-wide approach. Lastly, and perhaps for me the most significant lesson, is that citizens respond. Health-seeking behavior has improved. There was a demonstrable increase in health facility visits as well as admissions. This, therefore, has reaffirmed my government's commitment to soldier on and make further investments in affordable health care. It continues to be a work in progress, and we are inching closer to the leave no one behind, with a special focus on the most vulnerable in our society. Ladies and gentlemen, my government will continue to implement health care in a whole-of-government approach, seeking to leverage lessons learned and to capitalize on the devolution of health services, which has provided an opportunity for the implementation of health services that are people-centered and responsive to their needs. This meeting presents us with an opportunity to once again renew and galvanize our political commitments while creating more partnerships towards the realization of universal health coverage for all. My government looks forward to creating partnerships that will assist us realize major capital investments in health, while at the same time focusing on basic primary healthcare services and finding ways of integrating cost-effective technological advances in providing care, even at the lowest level. I wish to reiterate the support and commitment of my government to contribute to global efforts towards the achievement of universal health coverage and all sustainable development goals.